From the JAMA Network, this is JAMA Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinion featured in JAMA.
Welcome to this JAMA Author Interviews podcast. I'm Dr. Tracy Lieu, Senior Editor at JAMA, pediatrician and Director of the Division of Research at Kaiser Permanente, Northern California. Today, I'm delighted to welcome Dr. Suchitra Rao, author of a new editorial in JAMA titled Uncovering Long COVID in Children. Dr. Rao is Associate Professor of Pediatrics in Infectious Diseases and Hospital Medicine at the University of Colorado School of Medicine and Associate Medical Director of Infection Prevention and Control at Children's Hospital, Colorado. So is it okay if we go on a first-name basis?
Absolutely.
Great. So, let's start with some context. What is long COVID, and is it actually important in children and adolescents?
Long COVID is very broadly defined as signs, symptoms, and conditions that continue to occur or develop after initial SARS-CoV-2 infection. The long COVID symptoms and conditions are very heterogeneous and can affect virtually any organ system in the body. And there has been sort of an acknowledgement of SARS-CoV-2 or long COVID in adults, but I think that we have to have a growing understanding that this is also something that can afflict children as well as adolescents. I think the other piece to this that can be a little challenging is that this condition really goes by a lot of different names. So there's long COVID, there's the post-acute sequelae of SARS-CoV-2 or PASC, there's post-COVID condition. All of these have slightly different definitions in terms of how long someone experiences symptoms for, which I think can get very confusing for individuals who are sort of suffering from these conditions, as well as people who are reviewing different parts of the literature, since these different definitions can lead to sort of different terminologies and different definitions and prevalence estimates.
Yes, and actually on a related note, your editorial provides perspective on an original investigation by Rachel Gross and colleagues, and it's from the perspective Recover Pediatrics cohort, and it's titled Characterizing Post-Acute Sequelae of SARS-CoV-2 in Children and Adolescents. Can you tell us about the NIH Recover initiative?
Yeah, absolutely. So Recover stands for Researching COVID to Enhance Recovery, and it is funded by the National Institutes of Health. And it is a large nationwide research program that is conducted in the US, which is seeking to characterize the natural history, the mechanisms, and the long-term effects of long COVID in children and adults to inform future treatment and prevention efforts. And so in Recover, medical as well as social, laboratory, microbiologic, biologic, and immunologic data are being collected to characterize symptoms associated with PASC really across the full life spectrum. And there are many studies underway exploring the epidemiology, the underlying pathophysiology, patient-reported outcomes, and in the adult cohort, clinical trials to evaluate different treatment approaches for long COVID. And then on the pediatric side, there is a prospective branch that is consisting of clinical cohorts from more than 100 study sites. So far, they've enrolled close to 13,000 children. And then we also have a retrospective EHR cohort with data from close to 9 million records.
And this new study is about the prospective cohort, correct?
So this manuscript is really one of the first main findings to come from the pediatric prospective cohort. And it was exploring some of the more common symptoms as well as phenotype clusters that were associated with long COVID and characterized these differences by different age groupings and developed research indices to help sort of characterize this condition. In this study, it was a combined retrospective and prospective longitudinal study of 4 different research cohorts spanning 60 different sites across the US. It comprised around 5,400 children and adolescents with long COVID. And these were children and adolescents enrolled in March of 22 through to December of 23. It also included seronegative controls as well. And in terms of some of the data that was being collected, they looked at different long COVID symptoms as well as PROMIS global health scales to look at outcomes. And these were all completed at least 90 days after the initial COVID-19 infection. So the investigators were looking at different symptoms, characterizing these as different symptom profiles, and then used a model using a penalized logistic regression approach to develop an empirically derived research index for researchers to identify PASC. And then they did some correlation analyses to explore the relationships between some of these indices and some of the main patient-reported outcomes.
Great. Can you tell us the highlights of the major findings? And I'm particularly interested in how long COVID differs in children, adolescents, and adults.
So I would say the main takeaways from this paper was that at least one prolonged symptom was identified in 45% of infected children and 39% of uninfected children. So that was 12% higher than what was being seen for those uninfected cohorts. And some of the more common symptoms that were being seen in children included things like headaches, trouble with memory or focusing, and trouble sleeping, as well as abdominal pain. And this was slightly different to what was being observed in adolescents. So what was being seen there were things like daytime tiredness or sleepiness or low energy, having body, muscle, or joint pain, as well as headaches and trouble with focusing and with memory. And when they were trying to characterize different groupings or subthemes, there were different symptom clusters that were being seen in children compared with adolescents as well. So among children, the 4 different clusters included a group that was more multi-system body involvement, another group that was more predominantly comprised of headaches and musculoskeletal pain and having low energy or sleepiness, another group that was trouble sleeping, trouble with memory and focusing, as well as gastrointestinal manifestations. And then among the adolescents, there were 3 general clusters that were identified. So one, again, was more of this multi-system involvement, another with musculoskeletal pain and low energy or sleepiness, and then another grouping that was more predominantly change or loss of smell and taste. I thought that this study was a really nice companion piece to a study that was published by the adult investigators previously in JAMA that highlighted some of the differences that we're seeing in children compared with adolescents compared to what we're seeing in adults. So for example, in children, we were seeing more of those GI manifestations that would be things like abdominal pain, diarrhea, nausea. And in adolescents, we were seeing more of the loss of taste and smell, which was what was being described in the adult groupings. And I thought headaches were a predominant feature in children, which I think was also different to what we were seeing with adolescents and the adults. I see that the adolescents had a predominant symptom cluster that was sort of overlapping between children and adults, but it does appear that those younger children do seem to have sort of different symptom presentations. It's a very difficult population to study, as you know, because we're dealing with this evolving developmental stage in young children. We're also dealing with a situation where there may not be self-report or the ability to recognize some of these symptoms, which has made study of long COVID in younger age groups very challenging.
So now that we have these indices, what are the implications for clinicians who see these children and adolescents? Can we take them and go out and apply them in clinical practice?
So the authors do caution against the use of these indices at this time. Again, since it is a highly evolving condition, there's a lot of additional studies that are underway, and this doesn't capture the full spectrum of symptoms that one might experience. So for now, it may be something best used to research studies. And over time, these types of indices may evolve and become sort of better at predicting and identifying patients and children with long COVID. So I think the main takeaway for clinicians is really just that recognition that long COVID does occur in children as well as in adults, that there are a number of overlapping features to what has been described in adult studies, especially among the adolescent populations, but distinct patterns are emerging that are different in children. And just highlighting again that this is a very difficult condition to be dealing with because there is no single test for long COVID that exists. It is hard to diagnose given its overlap with many other conditions, and there's really no evidence-based treatment at this stage. So when I talk with clinicians or when I see a patient with long COVID symptoms, I think the main hallmarks are still to do a comprehensive evaluation to really get a sense of all their different symptoms and what they're presenting with, to try to assess what other additional detailed evaluations might be helpful, to identify red flag symptoms that may warrant urgent further testing, to consider who else you need in your sort of armamentarium in terms of specialists and other referral groups, and to try to identify long COVID that might be differentiated from other pre-existing or new conditions that might require a different therapeutic approach. And I think that really focusing on the impact of everyday functioning in children and adolescents is going to be extremely important. And I do still think that one of the most powerful things that we can do as clinicians is to really listen to our patients and to validate their illness and their concerns, which I think can really go a long way towards helping these individuals adjust to having a chronic illness.
Suchitra, thank you so much for your really well-informed perspective and your expert advice for clinicians as well.
It's been such a pleasure. Thank you.
I'm Dr. Tracy Lieu, and I've been speaking with Dr. Suchitra Rao about her editorial, Uncovering Long COVID in Children. You can find a link to her editorial and the original investigation by Dr. Rachel Gross in this episode's description. This episode was produced by Shelley Steffens at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or wherever you get your podcasts. Thanks for listening.